For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the digital health transformation agenda.
Juhudi za Kenya za kufanikisha upatikanaji wa huduma za afya kwa wote zimepiga hatua, huku Wakenya milioni 24.8 sajiliwa kwa halmashauri ya afya ya jamii almaarufu kama SHA. Waziri wa Afya Aden Duale amesifia maendeleo hayo, akitaja kuwa yametokana na mageuzi yaliyotekelezwa katika halmashauri hiyo. Akizungumza siku ya Jumatano wakati wa kikao na wanahabari katika makao makuu ya SHA jijini Nairobi, Duale alifichua kwamba ufanisi huo umechangiwa na kampeni kabambe za usajili katika kaunti zote 47. Kulingana na Waziri Duale, Wakenya milioni 4.5 wamepokea matibabu ya magonjwa ya kawaida na huduma za uzazi kupitia hazina ya huduma za msingi, huku Wakenya milioni 2.2 wakinufaika kutokana na huduma maalum, wakiwemo wagonjwa 8,000 wanaopokea matibabu ya figo na 18,000 wanaotibiwa saratani. Aliongeza kwamba visa 5,500 vya kujifungua vimeshughulikiwa tangu Oktoba mwaka jana. Kufikia sasa, Duale amesema shilingi bilioni 6.8 zimelipwa chini ya malipo ya matibabu ya huduma za msingi, huku shilingi bilioni 1.5 zikitazamiwa kulipwa wiki ijayo. Aidha, alitoa wito kwa Wakenya kutoa ripoti kuhusu malipo yasiyo halali katika vituo vya matibabu vya serikali, akisisitiza kwamba shilingi bilioni 13 zimetengwa kufadhili matibabu ya huduma za kimsingi bila malipo katika hospitali za ngazi ya level 2 hadi kiwango cha level 4. Duale alisema amepokea ripoti kutoka tume huru iliyochunguza sakata ya uuzaji na upandikizaji wa figo.
For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the digital health transformation agenda, which are very, very important pillars in achieving universal health care coverage. Through Taifa Care, we want to ensure that every Kenyan can access health care without financial hardship. The integration of the Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Chronic and Critical Fund is reshaping the health financing landscape in our country because it is inclusive and because it is responsive. The Social Health Authority, which is very central to this transformation, has of today registered 24.7 million Kenyans. They have already enrolled that number. And out of these, over 6 million Kenyans have underwent through the mean testing with an average contribution of 590. That is why the governor is paying close to 40,000 for her Social Health Authority Insurance Fund. That's why I'm paying over 35,000. And that is why Mama Mboga, when she goes through the mean testing, average is 590. So our commitment to make sure that healthcare is accessible, is equitable, and is affordable has come to pass. And this is a very clear sign of public trust in the system. Nakuru County, as of today, has registered 840,386, constituting 39% of the population. So we still have huge numbers to cover in Nakuru County. We have only covered, those who have registered are only 39%. And only a fraction of the registered households have paid their premiums. A lot of people have asked us, how do the informal sector, the salaried people, their contribution is paid by the employer? How do Mama Mboga, how do the people in the informal sector, how do they pay the annual premium if they don't have the money? We have said it, Lipa Sha Pole Pole initiative has brought affordability and flexibility. And I want to tell the people of Kenya, every day between 8,000 to 10,000 Kenyans in the informal sector pay their annual premium. The Lipa Sha Pole Pole is a very progressive because it tells you if you are to pay, for example, and this I need to make it clear, if after you go through the mean testing and you are told your annual monthly premium is 300, you multiply by 12, it comes to 3,600. Then you pay 4 months in advance. Then the balance you are told, do you want to pay weekly, monthly, or daily? And last night you could see in our system, there are Kenyans who went through that system, and daily they are paying 10 shillings, 15 shillings. And at the end of the day, the system will tell you, pay. If you don't pay that day, the next day you'll pay double, 20 shillings. In Nakuru, we have got 409 healthcare providers who are contracted with SHA. We only have 6 public facilities, but those we have found out are not really under the county. Maybe health centers in Egerton University, health centers in our prisons or in our security agencies. As of today, we have paid 43.9 billion from SHIF and 5.6 billion from PhD fund. And let me make it very clear, and I have told the governor and the leadership here, the primary health care fund is free. Kenyans should walk to any facility, be it public, private, faith-based, in level 2 to level 4. You walk in, you walk out, you are treated. The government of Kenya, under the leadership of President William Ruto, pays for it. In fact, we have just told the governor to put posters in all those facilities saying, enter and exit, you should not pay. And we are telling Kenya, the parliamentarians are here. They have budgeted 13 billion for that fund, capitation. So if any Kenyan is charged for primary health care, that is an offense, is a criminal offense. And Kenyans must report through our call center 147. But as of today, 5.6 billion has been paid from that fund. SHA is transforming our health facilities, and in Nakuru County alone, 1.27 billion in SHA claims have been disbursed. And as the governor said, the Nakuru PGH, our referral hospital, in terms of lodging claims, in terms of payment and system, is the best in the country. We need to clap for. And we have seen that the healthcare system in Nakuru is up and running. It is something that many other people should borrow from. Let me come to the National Equipment Support Program, because we want to make sure, this government wants to make sure, for universal health care to succeed, we must have drugs in every facility. For universal health care to succeed, we must have the right equipment in our health facilities. And in this program of the National Equipment Support Program, which is transforming access to care. And this equipment, let me make it very clear, it is not bought by the national government, it's not bought by the county government, it is bought by the suppliers, it is fee for service. They are the ones who will take care of those facilities, those equipments. The number of Kenyans who use that facility, SHA will reimburse those equipment owners. So there's no investment. And the governor, I am very happy to report that Nakuru County will in the next 2 weeks realize the impact of the National Equipment Support Program. The following equipment will be installed in the month of from the first week of August. In Annex Hospital, we are going to install a mammogram, dialysis machines, and orthopedic machines. In Bondeni Sub-County Hospital, a specialized laboratory service equipment will be installed. In Molo Sub-County Hospital, digital X-ray, CT scan, routine laboratory service equipments, and all others that are required, that are requested, will be installed. The same for Bahati, CT scan, and general theater services. For Karingate, they have all that, digital X-ray, Langa Langa Sub-County, Subukia Sub-County, Oromgroni sub-county, Njoro sub-county, Maimayu level 3. All these sub-county hospitals will receive the latest equipment. This intervention will bridge the critical gap and expand equitable. As we move forward, let us recognize that health is not just about systems. It's about trust, it's about dignity, and it's about community. And that's why the dignity of the patient is of paramount importance. Going forward, the patient is the boss, not the facility, not the healthcare worker, not the leadership. And that's why we have introduced, and this is very clear, we have introduced in the last 3 weeks something called bed capacity access code. No Kenyan, no health facility, be it public, private, faith-based, will be allowed to operate outside their bed capacity given to them by the regulator, who is here, Dr. Kariuki. When you apply for a license, you must say how many beds do you need. If you say 50, you will admit 50 patients. No more Kenyans sleeping on the floor. No more Kenyans sharing beds. Kenyans who don't know each other, they have different ailments. And if you tell us, oh, they are Kenyans, we can't return them, from Nairobi, from my office, the office of the PS, from our people here, the digital CEO, the SHA CEO, we will call the governor. We have told her this morning, this is how the bed capacities are. All your hospitals have enough beds, empty. So before, what used to happen under the NHIF, let me tell the country, when Kenyans sleep on the floor, they used to charge NHIF for a bed. When Kenyans share one bed, they used to charge 3 beds. So it was Ukora na Wizi. So I have stood my ground. Next week or the other week, no pharmacy will dispense drugs without a qualified pharmacist. No drug will be dispensed to a Kenyan if that drug has not been approved by the pharmacy and the poison board regulator. This is part of the huge transformation, health reforms we are bringing as a government under the able leadership of President Ruto. Finally, let me say that let today be not more than a celebration for us. Let it be a call to action, to dignity, to digitally enable every facility, to enroll every Kenyan, and ensure every shilling delivers better healthcare outcomes. And the Nation Media House, yesterday you showed one of my patients. You know, patients belong to Ministry of Health, so patients belong to me. Please tell your editors that that patient still has some money in his SHA. I've confirmed with the CEO. So he has not completed his cover. And next time, he doesn't need to go to Nation Media Center. He needs to go to SHA's headquarters, or he calls our call center 147. The number of facilities we have closed, we are closing every day. As I'm sitting here, the regulators are closing. But the ones that I have on my file, they are over 1,000. 1,058. And we shall close more. They are being closed for a number of reasons. And we have also downgraded about 458. They are at level 2. They claim to provide services of level 4. So we are telling them, if we downgrade you, once you reach your level, we will. Your next question was on cancer. There's a specialist here. Mercy?
Yes.
Yeah.
Well, Waziri, thank you for making me an oncologist today. I am not an oncologist, but I will explain to you the current benefit package that we have for cancer care. So under cancer care, Kenyans are eligible to 550,000 Kenya shillings. That's a little bit over 500,000 Kenya shillings. And this package covers for all types of cancer. Now, the journey of a cancer patient is particular in a manner where step 1 is to plan out the management of this patient. And step one involves diagnosis. We need to find out what kind of cancer do you have and what stage of cancer do you have. And to do that, SHA actually has and reimburses the tests required, the biopsies required to determine the diagnosis of the patient. Once we have the diagnosis of the patient, we then define the management plan. And the management plan can be surgical or medical or both. If it is a surgical plan, then surgery is actually catered for on SHA rates that are available in the tariff, depending on what part of the body would be excised, where the tumor would be taken out. Now, if this patient is determined to require both medical and surgical care will be covered by SHA, and we have those examples of patients who've received surgical care. Two, medical care will now involve chemotherapy cycles at that cap limit of 550K. And so erroneously so, the patient who came to your offices still has a balance in his cover, and he has not exhausted his cover. And we're willing to help him. He just needs to dial 147, and we'll attend to his case and educate him on the cover and the availability of his cover. Now, once that is complete and a patient has exhausted all the cycles that they require, they then are to the ECCI fund, where we have 50K Kenya shillings. And so the cancer package under SHA is actually better and more comprehensive compared to that was in NHI.
I think that's all. The third one was what? The third question was on? No. If a facility, first I said facility must admit based on their bed capacity, which they have, which is on their license from the regulator. If they increase their bed capacity, the regulator's portal is online. They notify him, they can increase. But if you have more patients, buy more beds. If you have more beds and you have no place to put, build more wards. Simple as that. The problem, okay, there's a guy, the owner of the system. I can answer that question. I think he can do better.
Thank you so much, Waziri. The portal system picks data directly from the regulator. So if your license says you have 10 beds and you update it in the regulator system, the SHA provider portal only consumes that data directly from the regulators. So if you have beds and you can't see them in the SHA provider portal, the place to go is not SHA, neither DHA. The place to go is your regulator. He looks at your license, he looks at the number of beds you need to have, he looks at your inspection, then he updates. When he updates, it's real time. It takes less than a second to update in the SHA provider portal. Thank you. Okay, on the issues of discharge, please ensure that we want to urge all our facilities that when a patient walks in, ensure that you have admitted that patient in the system, so that by the time you are discharging them, the system is able to recognize them. If you have more patients than what has been discharged in the system, then what the system does is it calculates the active patients within the ecosystem and the number of beds that you have, and then it's able to lock you out. But we urge you that anytime you have patients that need to be discharged, also ensure that you discharge them in the system. We have found facilities that have patients already who have left the hospital, but they have not discharged them in the system. That gives you a problem, because then it is consuming those beds that you have been allocated. And SHA will use that data as provided for by the regulator, which can be KMPDC, it can be clinical counseling. Thank you.